So today we will start with the floor of the cranial cavity. Floor of the cranial cavity is formed by 5 bones. You are seeing the anterior is frontal bone. In between the frontal bones, you are seeing the ethmoid bone, and the yellow one is sphenoid bone. Behind the sphenoid bone, this is temporal bone, and the posteriormost is occipital bone. So these 5 bones form the floor of the cranial cavity. The cranial cavity is divided into 3 fossa: anterior cranial fossa, middle cranial fossa, and posterior cranial fossa by 2 borders. So these borders, you can define these borders. So anterior border is, you are seeing here, this is the posterior border of the lesser wing of sphenoid, then anterior clinoid process, anterior border of the sulcus chiasmaticus in the midline. And again you are getting the anterior clinoid process and the posterior border of the lesser wing of sphenoid. So before going to the this is anterior to this is anterior cranial fossa, and the boundary of the posterior boundary of middle cranial fossa is, this is the superior border of the petrous part of temporal bone, and this is the dorsum chili of sphenoid bone. Then again you are getting the superior border of the petrous part of temporal bone. Between the anterior border and posterior border, between the anterior and posterior border, you are getting the middle cranial fossa, and behind the posterior border you are getting the posterior cranial fossa. So start with the anterior cranial fossa. You are seeing the anterior cranial fossa is made up of 3 bones. These are frontal bones. These are orbital parts of frontal bone. In between orbital parts of frontal bone, you are seeing the part of the ethmoid bone. This part is known as cribriform plate of ethmoid bone. And behind these two structures, you are getting the body and lesser wing of sphenoid bone. This is lesser wing of sphenoid bone, and between these lesser wing you are getting the body of sphenoid. This is body of sphenoid bone. So we will start with the frontal bone first. So this is frontal bone. Frontal bone having squamous part. This thin plate of bone is squamous part. Then orbital plate. This is orbital plate of frontal bone. Then this part between 2 orbital plates is nasal part. This is nasal part. These are orbital plates, and 2 processes, zygomatic process. These are zygomatic process. To hold the frontal bone in anatomical position, you should remember that the external surface of the squamous part is convex, and the orbital part of the frontal bone lie in horizontal plane. So by knowing this, you can hold the frontal bone in anatomical position. So you are saying that the part of bone which is present between the squamous part and orbital part, this part is called supraorbital margin, and just above the supraorbital margin there is a arch-shaped elevation of bone is known as superciliary arch. So here you will get the superciliary arch both sides, and in the median plane between the median end of superciliary arch there is a elevation known as glabella. It's known as glabella. Now above the superciliary arch there is a small depression, and just above it there is a elevation both sides known as frontal eminence. So once again we will revise. We get the supraorbital margin, just above the supraorbital margin superciliary arch, and between the median end of superciliary arch you are getting the glabella, and above the superciliary arch you are getting both sides the frontal eminence. Now nasal part is present between the 2 supraorbital margin. This is nasal part. This is a projected part in the median region, and it is having nasal notch and nasal spine in the median plane. So it has having nasal notch and nasal spine. Nasal notch articulates with three bones. In the median plane, it articulates with the nasal bone, both sides, and after that, it articulates with the frontal process of maxilla. Then it articulates with the lacrimal bone. The red one is lacrimal bone. This is very thin plate of bone. So, median to lateral, it articulates with the nasal bone, frontal process of maxilla, and lacrimal bone. Nasal spine anteriorly articulates with, or it supports the nasal bones, and posteriorly it articulates with the ethmoid bone. So between these two orbital plates, you are seeing there is a notch. This notch is known as ethmoidal notch because ethmoidal bone, cribriform plate of ethmoidal bone present in this notch, and you are seeing the two transverse notch line here, one anterior and posterior. These are anterior one is known as anterior ethmoidal notch, and posterior one is known as posterior ethmoidal notch. When cribriform plate of ethmoidal bone articulates in this notch, ethmoidal notch, then it becomes the foramina. The anterior one is known as anterior ethmoidal foramina. The posterior one is known as posterior ethmoidal foramina. So, below in this picture you are seeing that how ethmoid bone is articulated with the frontal bone, and it is present in the ethmoidal notch. You are seeing this yellow one is ethmoidal bone, and in between you are seeing the cribriform plate, and in the median line you are seeing the perpendicular plate of ethmoid bone.